Welcome in. My name is Colton, and I'm in this population health class with you guys. And here's my presentation about my health issue here. It was diabetes education for underserved populations. So, health problem and issue here. Uh, some stuff. I grew up in Spokane. I live here still, and I was interested to just look at how can I best serve the neighborhood in my community here. So, I was surprised to find out that 32% of Spokane is obese, and that 10% of the adults here in Spokane have diabetes. What was more surprising was that the rates increased to 15% if you made less than $25,000 annually, and also that 20% of individuals over the age of 65 had diabetes as well. Um, so, as nurses, we know that obesity, a sedentary lifestyle, can be one of the leading causes of causing diabetes. So the two are definitely tied together here. If Spokane continues to have this high of an obesity rate, it makes sense that the diabetes rate's either only going to continue to climb from here. Yes, so Spokane is obese. Spokane has a decent diabetes rate here. It gets worse as your income and education level go down. The question is, how much worse? So, uh, poverty level here in Spokane as a whole is around 15.3%. And of that 15.3%, 20% of those uh, near this poverty line did not complete a high school diploma or GED equivalent. So, remember, diabetes is increasing for this specific population, the 20% of this 15%. On top of having high rates of diabetes, they also have way worse access to healthcare in the Spokane area due to the shortage of available primary care workers here. Um, and other issues that I was surprised about were that um, diabetes, hypertension, and obesity all got worse as your income at least decreased. So we're looking at people with diabetes, we're looking at individuals here near the poverty line with diabetes, and it's to Healthy People 2030 is that one of the objectives is to increase the proportion of people with diabetes who receive formal diabetes education. Formal diabetes education helps individuals develop the knowledge, skills, and confidence to effectively manage the disease. And we all know that effective disease management of this chronic condition can lead to improved health outcomes. So, as of 2023, only 47.7% of adults diagnosed with diabetes have had formal education on diabetes management. This has been trending down. In 2019, 55.2% of the population had formal diabetes education. So, no secret what happened after 2019 there, pandemic. It's been hard to get back to a lot of those numbers pre-pandemic. We're working on it, right? So our goal here is to find a way to work on increasing this proportion of adults who with diabetes who get this formal diabetes education. Before we look at how we're going to work on increasing this rate of diabetes education, let's look at a little overview of our community here in Spokane. So specifically in Spokane, very very large area here. We have over 554,000 individuals. Um, It's the second largest city here in the state of Washington. So I got to narrow this down. I can't look at all of Spokane, Spokane Valley, the greater Deer Park area. So we are specifically looking here at the west central neighborhood. On this graphic, you can see the little dotted line here. If you look kind of on the river on the left side over there on that west side border, you can see the little dotted line. It kind of runs up Indiana Avenue and then runs north south down Monroe. So this neighborhood is older and it's definitely considered more on the socioeconomic decline side of Spokane here. Smaller houses, cheaper housing, a lot of apartments, except for that area on the south there where it says Kendall Yards. That area has recently been gentrified out the wazoo. It's a very nice housing, multi-housing condo area, shops that's been remodeled. Outside of that, the rest of West Central, definitely more on the impoverished end here of the spectrum of Spokane. This area has one good park. You can see that park in the north. That is Cannon Park. The courthouse is also located in this area. Um, Health-wise, they do have the Native Project, which serves low-income individuals kind of up in the north corner. They have Asante Health, which is at the community center, and Chaz North Central Clinic is kind of like off this map just a little in the north, but it's very close to West Central. And then the Providence House of Charity Clinic is also in this area. So those are some of the healthcare options this area has. This area isn't for exactly like a lack of healthcare options, just of course a shortage of providers. They also have some charities around in the area. House of Charity is located here, kind of on the west side. Our Place Community Outreach is kind of right next to the Kendall Yards area. The YMCA is really close to the Monroe Street Bridge. Um, this area doesn't have any buses that run directly through it. However, the bus stops do run north-south along the Monroe Street border there on that good old east side. And like I said, there's a more diverse area compared to Spokane that's traditionally a very Caucasian area. A lot of people who settle in that are migrant families, Latino, African American, and some of the Marshallese Island migrants are all settled in this area because the housing here is affordable. So just focused in here on one specific neighborhood of Spokane with a couple health options and clinics around, and also focus here on a neighborhood in Spokane that is traditionally a little bit more impoverished and has a lower education level for kind of the surrounding area. Okay, so stick with me here through my community diagnosis. So lack of diabetes education in the Spokane, specifically the West Central population experiencing poverty, leads to increased rates of uncontrolled diabetes and later diabetic comorbidities such as cardiac, renal, or eye issues. 20% of individuals without a GED or diploma live around or below the poverty line, and individuals who did not graduate high school or have a GED have a higher chance of acquiring diabetes compared to those with a diploma or higher education. This is as evidenced by the decreasing rate of diabetic education nationally, where 47.8% of diabetics say they are properly informed on managing the disease. The rate of diabetes for individuals in Spokane making less than 25% annually is almost 15%, and diabetes is the eighth leading cause of death here in Spokane. Also indirectly related to the statistic that heart disease is the second leading cause of death in the Spokane area. So just to summarize that giant wordy statement, education and income matter. A lack of education can be a leading cause of having an income at or around the poverty line. Having an income at or around the poverty line can lead to higher chances of acquiring diabetes and complications around diabetes, such as cardiac, renal, or vision issues. Okay, so now that we have our statement of diagnosis, we have our community, it was time to dive into the literature. What is going to help us produce some successful diabetes education where way more people are able to participate in it? So first we pulled up here some of the national standards, and they talked about a whole bunch of stuff on this slide that I'm just going to run through. I'm not just going to read it directly to you. So some of the demographic characteristics can include, of course, race, ethnic or cultural background, sex, age, geographic location, which we picked here in this presentation, technology access. That's going to come into play here later. Levels of formal education, which we've talked about, number high for this group, literacy level, health literacy, and the population's perception of risk associated with diabetes. That'd be one you'd have to ask some more questions about to get a little bit more detailed to the related complications they understand about diabetes, and maybe some co-occurring conditions uh, along with diabetes here would also be key to consider. Another key fact here that the national standards pointed out is that in order to promote access to diabetes self-management education, Population barriers and health inequities have to be thoroughly addressed before you can begin making any kind of difference. Some of these barriers to be aware of as you're planning your strategies should include socioeconomics, cultural factors, misaligned schedules with the public, health insurance shortfalls, perceived lack of need of any education to begin with, and limited encouragement from healthcare professionals to engage in diabetes self-management education. The social determinants of health related to this pet target population should guide service design and delivery of the education that you're going to try to engage in and how to get more people involved. Um, Diabetes education team was also talked about who can be involved with it. Of course, everyone listed there. Nurses, registered nurses were a giant part of a lot of the studies that I spent time reading about here. Um, Two things that are a little bit newer that can be added to this team would be board certified in advanced diabetes management. So, like a nurse who's got that BCADM after it, and certified diabetes care and education specialists. Those are two different pieces of support staff that can be a part of the diabetes care team. Um, and one great thing about the two that I just named is that they can be a part of the clinical assessment, which the clinical assessment is this giant hour-long initial meeting about managing diabetes with the patient. So it can feel a little overwhelming. Maybe one of the reasons that we don't get a lot of or as many people complete the education as possible is that we don't have all of these team members engaged in offering to give the education to the patient. We might be just relying on just physicians or just pharmacists when in fact this whole team can be involved to make sure the patient is hearing it over and over again. I also talked about the curriculum to make sure you're using that. Of course, it talks about the pathophysiology of diabetes and then a whole bunch of healthy habits, right? Healthy coping with diabetes, eating, how to be active, how to take the medications accordingly, monitoring the blood sugar, and reducing the risk, just reducing risk of treating acute and chronic complications here. Last thing here that we're just going to touch on is that there are some of the newer stuff that the standards and the national standards of diabetes education are trying to touch on here is using tech. So delivering this diabetes self-management education through virtual telehealth, telephone, text messaging, or web-based or mobile phone applications to strengthen, reinforce, and even introduce some of the education. That all of those are options to make sure the education you're giving is meeting the national standards set. And the last one came out in 2022. So now that we've looked at what should be in the education, another piece that I really wanted to explore here was components, um, like how was the education successfully delivered? I mean, they always use a bunch of terms in education like, oh, make it dynamic, make it interactive, and I just wanted to focus here on individual and group education classes. To summarize, just make sure we're on the same page here. The national standards told us what information to look at, what should be included, some barriers to look at for the group, who should be delivering the education, and then I found this meta-analysis here. It was 18 studies and 6,000 participants that looked at giving this education that we just talked about from the national standards in individual or group classes, and were either of those strategies beneficial education? Did more people get involved in one or the other? Um, and it looked like they were really good. The classes were for helping people better manage their diabetes. So that was great. So it was successful education, lowering A1C, decreasing BMI, uh, safely lowering blood pressure and total cholesterol. You can see some of those numbers. Yes, there's some slight positive ranges on those as well for a lot of the group classes stuff, but that's just what happens when you take 18 studies that are all done a little bit differently. Um, they were talking about how like the individual sessions, that hour-long assessment, very important here in building trust and rapport with the providers. People are way more engaged in showing up to that one, being a part of it. And that was the one that had the best factor on just A1C straight up. That minus 1.6% drop with the individual education portion of it. Um, let's continue here to talk about some of these group classes. So more key information here about these group classes, not just what they were successful at. Um, in the group setting here, majority of the education was performed by RNs. The average length of these group classes was 10 months in total length. Some of them met weekly, quarterly, first weekly, and then spreading it out a little bit more. There was a lot of variation in there, but overall it was 10 months. And then one good thing was that group members could hold each other accountable and continue to show up and feel motivated to be part of a group that was all accomplishing something. The downsides of the group classes were dropout, which was very frequent. Um, one study reported that only 70% of people starting finished it. The other downside is that not all the people can meet all the time, so that scheduling these group classes can be very difficult to keep people coming. Um, individual classes had a way higher turnout. They had a turnout over 90% in the studies there, but uh, the downside there of those individual classes can be time for providers. You spent time with one individual talking about one issue here, which is hard to justify giving that much time to. And reach wise, you again only helped one individual at a time here. The one other key piece of evidence I thought was interesting from this study was that there was minimal BMI decreases, and you would think, oh yeah, we already talked about obesity earlier, and that a sedentary lifestyle and obesity, this can be one of the leading causes of diabetes, and you would think that a lot of this education would really favor how do we actually make a tangible decrease here in BMI, not just A1C. But that can be the downfall of if you just talk about everything hypothetically and you don't actually implement anything. One of the studies did implement like a full workout plan and diet plan for people, and they saw way greater decrease in BMI compared to the rest of the studies. Okay, so looking here at how do we increase uh, the amount of diabetic people taking and participating in diabetes education. I've looked to see if the national standards told us how do we increase numbers. National standards told us exactly what to include in there, which is a bunch of good information. Told us to make it really dynamic and engaging, and then said be aware of all these barriers to completing diabetes education, but didn't offer a whole bunch of solutions. And then I said, okay, well, maybe it's how it's being presented. Maybe more people will be in if it's presented better, more in a more engaging way. And that was looking at individual and groups classes, which are both really successful at lowering A1C, a whole bunch of other physiological interventions there. But again, that didn't really help us get more education to more people. You would think, yes, group sessions, we can get more education to more people. Are people participating in it? Are people able to make it, especially if there's a couple barriers to getting there, socioeconomic, economics, scheduling, and so forth. So that those two didn't really help me. And in fact, Spokane as a city has really good diabetes education options here. They offer group and individual classes here through Chaz, Multicare, and Providence Health. Remember, Chaz has a location here in the neighborhood we're looking at, the West Central one, and Providence Health has the House of Charity, also a location here in the West Central neighborhood. Some of the drawbacks here is that insurance is necessary for Providence and Multicare. They have limited start dates of when they offer the education, and that referrals from primary care are necessary. Again, I'll say that again, that like you have to have a referral to get yourself into a lot of this diabetes education classes. So Chaz is an option. Chaz is an option here in the North Central location. They don't take insurance. They will work with your insurance, of course. They take Apple Health, which is Washington Medicaid. They also have a sliding scale fee option if you qualify for that. Um, so just touching here that Spokane has the infrastructure in place. They have endocrinologists, we have diabetes education specialists, both through Providence and Multicare. Chaz offers diabetes education. So it's not about having access here so much as we have multiple locations throughout Spokane that'll do this. It's increasing participation. How do we get more individuals to get these referrals so that they can participate in the formal diabetes education that is recognized by the American Diabetes Association. So then instead of looking at what are the national standards telling us what to do, how great is it to offer it in group or individual settings, it was more about how do we increase referrals to diabetes education here as a community. So trying to find what did the literature say about how you can get referrals to be increased, especially in areas that are underserved or rural. Um, how do you get more people to participate in diabetes education when the national standards are set and you have nothing to do with group or individual settings being used? So one study here with 105 individuals who were recently diagnosed with diabetes in the last 4 years found that 53% of them were not referred for diabetes self-management education at all by the provider. 53% no referral at all, even though uh, the American Diabetes Association says that a referral to diabetes self-management education should be performed one of the four chemo times in a diabetic person's time, sickness that it should be referred to is right at diagnosis. Um, Even better, 66% of those that were referred for diabetes education, so 66 that got the referral actually, hey, you should go, never participated in any education. That's again a bummer. Um, One thing again, backing up the education is important. Individuals with just 1 hour of diabetes self-management education had a better A1C compared to those with zero education. And those with 1 hour of diabetes education had a similar A1C compared to those with 8 hours of education. So basically, you just at least got to get 1 good hour in with people as diabetes here, and that has been found to make some sort of difference here in A1C and their health. Um, a different study here was looking at recruiting people for diabetes education that are difficult to reach participants. At these difficult to reach participants, it might be best to try and get a hold of them by utilizing technology, text messages, social media, email, and also community events. You'll notice I have text messages and community events highlighted because those are actually going to be part of our solution that I'll present here in a couple of slides. Last thing I want to touch on is that on the study on the left, Medicare and Medicaid will participate in covering and reimbursing education. Diabetes education here, where they'll cover the first hour, that big assessment hour that a lot of people like to participate in. They will also cover 9 other hours of group education or education about diabetes presented in some other way. So it really is just about how do you get these referrals out there because insurance will cover it. And it's been found to benefit these patients if they just get a little bit of education in so many different ways. Okay, so how do we go about getting more referrals so that we can make a better impact in this community and on the people who have diabetes, just so they can actually participate in some diabetes education? Why would we want to do this? We get to build some trust and build a healthier community. Stakeholders in the community that can help us out, that can help us use all of the great infrastructure for diabetes education already established here in Spokane is we have to utilize these healthcare agencies in the area. Again, Asante Health, Chaz Health, and the North Central Clinic that specialize in geriatric care, which is great because over 20% of those 65 and older have diabetes, and also utilizing the Native Project here in this area, as well as utilizing the Providence Charity House. If we can get them involved later, but starting out with these three would be the most important in my opinion. And then what are we gonna do? We've got the healthcare agencies involved that we want to ask about trying to set up a little team. We also need to know where we send this team out to. We have to send this team out to somewhere where they can find the people and places that I know you can find the people that are at or below the poverty line that would absolutely benefit from some education would be going to the two outreaches that are food distribution centers. So Our Place Community Outreach, which again on our map was towards the south, and the Off Broadway Lighthouse, which is a little bit more towards the riverside in this area. And both of them have these food distributions. Our place does twice a week. off Broadway was once a week. And I'm not telling you to establish these teams there twice a week, but once a week, you would send your team, and who's on this team? Medical assistants, RNs, diabetic educators. You send them here to try and work on gathering some referrals. So we're not just sending them out into the blue, though. We have a plan. We're going to have a team of these volunteer representatives that we just talked about on the last slide, set up a little tent, booth, station at the front of the food bank distribution centers here. They just go once a week. You can rotate teams. They can be coordinated. Chaz can have 1 week, Native Project another, Asante Health. It can literally be done with 3 people. You would have one coordinator from our place and our community or outreach. Just be aware if the team is here this week. If not, do they need any help? Um, so you have your little team there set up. They're there just at the beginning. They're just trying to be available here at the booth to hopefully talk to people, individuals as they come through the line, individuals who clearly are at or near the poverty line, most likely because they're at a food distribution bank. Um, Trying to do 2 things. If they would like to be able to give these people some information about diabetes and diabetes education management. As you can see, I've got a little display here in the middle, like a little fake one you would use. Just having the clinic hours, its location, its bus routes, some information about diabetes disease management, and a QR code with a link to the website. But really, the goal of this booth here is to try and set up a visit. We need to set up a visit because we have to get you a referral. Because if we can get you a referral, you can use all of the awesome education opportunities that Spokane already has. It doesn't feel feasible to try and come up with an entire branch of education just for West Central Spokane when Chaz is already there, Sante Health is already there, Native Project's already here. And also in this economy, just the cuts that they've made to Medicaid recently, it doesn't seem sustainable to come up with a whole new education program. What's about is trying to just get more referrals to take advantage of the strong diabetes education management classes that are already in place in the Spokane area. The booth here, these individuals, they're here to answer questions. They're here to put a friendly face to diabetes education, to get people excited about trying to manage their disease a little bit better if they haven't taken advantage of this diabetes education in the past, or if someone they know would benefit from it, they could give them their name as well. You're just collecting name, email, and a good old phone number here. Because if you can just get those 3, the list of these people, once you get it back to your clinic, you can make some calls. You can ask that individual if they would like to come in to set up an appointment, to find out if they have insurance at that point, to find out if they would benefit from just being on the fee sliding scale there with Chaz. Actually, all 3 take the sliding scale fees, which is why we've picked to work with them at this time. So this is all been about how do we get more referrals out there in place, more referrals for individuals so that they can take advantage of all of the education already established here in Spokane, preferably here. How do we know if we're actually getting more referrals out and helping anyone out? Um, for the individuals that came up that information was collected on, it's texting, it's sending the email from a phone established by the clinic and sending them a little online survey for that individual who gave us the information to fill out when they have a moment. It can be a very short survey. Um, it's just and it'll be about sending this little survey 1 week out, a month out, 3 months out, and 5 months out. Some of the questions here on this little short survey: did they follow up at the clinic? Because that's what we talked about, right? We wanted to get them established at the clinic so they could go get a referral. So did they actually follow up and go to the clinic yet? If they say no to that one, then none of these other ones really matter yet. And it's about how do we get you to follow up with one of these clinics in the area that hopefully is around somewhere you live. Um, did they get a referral? If they followed up at the clinic, did they get a referral to diabetes self-management education? Did they attend any diabetes self-management education? Are they still even interested in diabetes self-management education? Because if they are, we can assist them. We can get them remotivated. We can get them connected to someone at the clinic that, of course, isn't going to be able to give the ADA approved education, but can maybe answer some questions, maybe just try and get them re-engaged with coming in to get that referral, to get back out there and get some of the education on their own. Ideally here, if 15% of individuals who provide their information follow through with getting established at the clinic or getting a referral to diabetes self-management education within 5 minutes of initially contacting the booth, that would be a success. That would be a success. Trying to get more referrals in place, trying to get diabetes education to take place for more diabetics. And for a literally a volunteer booth operating 1 day a week, and just time per week and 1 time per month here, because we're going to rotate clinics as we go. Maybe in the future they could share that information with each other. Or you could pass the information along to the next week. That would hopefully be something that the um, food distribution places could make sure that information gets passed along with, to just be like, oh, hey, remember last week you asked Chaz and you said you'd already been up to Native Project and you'd rather talk to them. They're here this week. That would be something those coordinators could do on their end. But um, again, this is feasible. This is a short follow-up, and it seems appropriate to try and follow up 1 week out when people are probably really motivated still about, oh yeah, that was last week when I was there at the food bank and I met all those people. Following up a month out, giving them a little bit of space, following up 3 months out, and then 5 months out, and then stopping after that, not bothering people until again, maybe the new year hits, because of course, new year, new them. Do they want to follow up and do some diabetes self-management education? Of course. Finally, I'm almost done talking. We're at the conclusion here. So, just to sum it all up, Spokane has a high obesity rate and a high diabetes rate, and it doesn't really seem like either one's going to be trending down over the next couple of years. It's going to take some time. So, if they're both going to be trending up, we definitely could be using some formal diabetes education, because so much of the literature showed us that if you can just even get a little bit of the education in, it can make a physiological difference on individuals who are living with diabetes. We focused on the West Central neighborhood here because that is a more impoverished, lower socioeconomic area here in Spokane. They have higher rate in that data says that those individuals near the poverty line have higher rates of diabetes. Also, individuals with lower levels of education have higher rates of diabetes. Again, goes hand in hand here that if you have a lack of education, you most likely live closer to the poverty line than those that don't. The great thing about Spokane is that we do have plenty of diabetes education opportunities between Chaz, Providence, and Multicare. We have clinics they can visit. Of course, worrying about transportation later, but we have clinics they can visit. We have plenty of care providers in place here. It's about how do we get more referrals out to more aggressively recruit people to want to seek this out with their provider. Can they ask their provider about getting a referral? Can we just put a bug in their ear out there to say you should come in, get established, get this referral so you can get this education done and manage this disease better on your own? And that these referrals do not take a whole lot. It's about being in the West Central neighborhood to specifically help them out. It's about being at areas in the West Central neighborhood that you know people are going to be involved at, which of course lower, more impoverished people more likely to be at those food banks that we can find them. We can maybe gather some information. We can maybe get them connected to a clinic, hopefully in the area where they're already living here, so that they can hopefully get a referral and get to participate in some diabetes education. Thank you so much for listening to me talk. Here's my giant reference slide with all those good references on it. Um, I'm so happy this presentation is finished, guys. I hope you are too. Thank you. Cheers.